pour assister à cette présentation. Donc, pour ceux qui ne me connaissent pas, je suis M. Nobleen, je suis directeur de la société Nobleen. Nobleen Pharma est une société qui aujourd'hui est divisée en 3 business units. Donc, la business unit des produits professionnels, donc ce sont les injectables, les produits de pilule, les produits de mésothérapie et les enzymes, etc. Ensuite, il y a la business unit des produits cosmétiques, donc les produits de prescription, bien sûr, avec la marque Mésosthétique. Et bien évidemment, celle qui nous intéresse aujourd'hui, c'est celle des équipements. Alors, en termes d'équipements, on a au niveau de notre portefeuille un tas de produits que certains que vous connaissez sûrement. Bien sûr, il y a la marque Photona, il y a la marque Jesus. Et puis, bien évidemment, depuis quelques temps, on a introduit une très belle marque dans notre portfolio, qui est le produit Nobleen. Nobleen, il intervient dans un contexte particulier où il y a toujours qui intéresse la médecine esthétique et la médecine dermatologique en manière générale, c'est qu'on a tous besoin d'avoir un laser épilatoire, mais ça intervient dans un contexte où le marché épilatoire est de plus en plus tendu. C'est-à-dire qu'il y a de plus en plus de pression, de prix, etc. Et donc la question qui est aujourd'hui cruciale, qui se pose beaucoup de médecins, c'est la rentabilité de ces équipements. Se lancer dans un investissement n'est plus aussi facile qu'avant. Donc il est aujourd'hui crucial de ne pas rester focalisé que sur une seule indication et on doit sortir le maximum de nos machines. Alors, Nobleen, elle s'inscrit parfaitement dans ce cadre. Okay, elle va aujourd'hui disposer de technologies très avancées, de plusieurs modalités, de plusieurs options. Et c'est tout le but de cette présentation. C'est vous les présenter et vous montrer tout ce que vous pouvez faire avec cette machine. Et c'est pas moi qui vais parler, c'est notre Dr Mill qui nous vient de parler qui va faire cette présentation. L'équipe de Finemec est là aussi présente avec M. Lee, qui est le CEO de la compagnie, donc il nous fait l'honneur d'être là et accompagné de mademoiselle Amy. Et voilà, donc j'espère que ça va être intéressant. Donc l'anglais, très basique. Très basique. Donc, et ambiance familiale, parce qu'on est un homme qui permet les interactions. N'hésitez pas à poser des questions en français, anglais, comme ça sort. Donc on est là pour faire le lien entre tous. D'accord? Donc I give now the stage to Dr. Mill, who is going to explain about the Nobleen glass. Thank you very much. One. Thank you.
I'm just introduced. My name is Min Kyung-sik, is Korean dermatologist. Good afternoon, doctors. It's all doctors is almost just one man doctor, is right? Yes, Monaco is pretty, very beautiful city. I invited the CEO and very thank you. Next. I'm briefly introduce myself. Next slide, please. This is my slide. Yes. Before. I'm a dermatologist with 30 years experience with laser treatment and other aesthetic treatment area. I'm very old man, and this year I'm 61 years old. Yes, this 30 years experience is very long time treatment, a lot of customer, and in other country, in China, go to any other country. Yes. Also, I have the executive member in Korean Dermatology Association also. Next slide. What dermatologists truly want? What you want to this machine? This means number one is treat pigment disease. Yes, usually pigment disease are melasma, yes, solar antigen, and post-inflammatory hyperpigmentation, and any others, but predictable result is very important things. Number two is permanent hair removal, very safe, very efficient hair reduction, and also permanently. Number three, also in vascularism, telangiectasia, rosacea, and leg pain. All of the vascular lesion is possible to treat. No any other side effect. It's very important. Is that and lots of acne and active acne. Any other inflammation is possible to treat. Yes, that. On lastly, rejuvenation of the skin and possible to skin lifting. This means is collagen production, also skin texture, and natural anti-aging result. This is our goal. Is that just one machine is all of this is possible. Machine is this is true. I don't know. But next. The past day, maybe 25 years ago, suddenly appeared vascular light. You know the vascular light? You heard that, yes. 25 years ago. First time is vascular lesion treatment. After that, is possible to pigment, is possible to rejuvenation of the skin, just like this. Number one is vascular light. After that, IPL is present IPL. Okay, IPL is almost of the pigment, also vascular, also rejuvenation, also. This is number two is IPL. But this is not precise. A little bit improved. Not to 100%. Is next slide. The limitation is IPL is non-selective target. Penetration is very shallow, sometimes very deep. Energy control is maybe skin type 4, sometimes skin type 5 person is a lot of burn damage and side effect. Yeah, this is a big problem. Yes, but IPL is very good. General improvement is very good. Not specific. That's next slide. At this time, this answer is very clear. It's long pulse Alexandrite and 755 nanometer, a long pulse NDR in 1064 nanometer. While this is 755, is absorption is melanin absorption is very high, and pigment disease and hair removal is possible. Long pulse NDR is possible. Is next slide. Okay. 1064 is a pigmentary target is hemoglobin, and collagen is primary target. Its main indication is vascular, acne, and skin rejuvenation. Is also 1064 is more deep penetration and collagen remodeling is part. Yes, before. But any other clinical evidences? Lots of extensive review literature and FDA clearance indication is worldwide clinical adoption, is long-term safety data. Also, is very versatile treatment parameter. Is next. Okay. We choose why Nobleen we choose that yes dual wavelengths, high capacity, and this is technical problem. Is next. And then photo rejuvenation precision is IPL made skin generally better. Nobleen make precisely better. It's more trajectory effect. That means that and best general improvement and present precision excellence result is that. Next. Yes. No. Okay. Next slide. Yes. Yes, absorption spectrum is 1064 nanometer is more deep penetration here. Yes. And deep penetration and hemoglobin. Yes, this is hemoglobin and a little bit melanin is there. And 755 is high. Melanin is black color is the absorption spectrum. A little bit hemoglobin, yes. Next slide. Yes. This is hair removal chart. There is that. It's Actually, hair removal, Nobleen hair removal is 2-way use that all of skin type 1 and skin type 6 is possible to treat that all of skin type. This fine hair is Alexandrite, the dark skin is NDR laser, the white skin, all of them, just like that. Next. And usually, we treatment is melasma and post-inflammatory hyperpigmentation is very bad. Treat is very not good. Usually that maybe 1 year, 2 years, but recently we use the triple toning technology as 3 methods: is QCT NDR and long pulse NDR fractional, long pulse Alexandrite fractional is 3 more. We tried that. Usually, some doctor want QCT NDR better than picosecond laser is more better. It's, I think, same. Why? QCT NDR laser using is melanocyte in the melanin granule or melanin in keratinocyte is target? No. Is we use very low power, 1.2, 1.4 joule per centimeter square. Use that. Yes, dermatologist said to dendrectomy. Understand? Dendrectomy. Yes. This is melanocyte dendrite. Yes, dendrectomy. We purpose is dendrite. Then cut off the dendrite. This is our purpose. And then long course fractional NDR is dermal rejuvenation and basement membrane rejuvenation. So our goal is that is the last 3. All of the whitening is all melanin is very quickly remove the long pulse Alexandrite fractional treatment is number 3. Yes, but this QCT NDR is one time apart 2 week 1 time. Long pulse NDR also 2 week 1 time. But long pulse Alexandrite fractional is 1 month 1 time is good. Next. Okay. It's possible to why choose Nobleen? Yes, fractional novel technique. I also explained that. Novel technique is novel lifting and novel toning. Novel toning is whitening treatment. Alexandra 755 nanometer fractional handpiece use that. And lifting is NDR using NDR. And very easy to control handpiece, zoom handpiece, square pulse. Yes, this is technology. Okay. Next slide. Yes. This is zoom handpiece. Zoom handpiece is just one handpiece as 2 millimeter to 20 millimeter. It's very easy to control. Why this is very important? Actually, a small group is possible to explain that. It's no problem. Yes. It's candle machine. Is handpiece is changed. All of the change it. Also, Simon Show also change handpiece, and any other company also change handpiece. It's easy to broken. Understand? This lens is easy to broken. Sometimes some problem, but there is not. It's very easy to control. Yes, next slide. And this is also technical problem, not that problem. Technical, yes, it's 5 milliseconds. Under the 5 milliseconds is 5, and over the 5 milliseconds is 50 milliseconds is PWM pulse mode. Next slide. Any others? Gas cooling is rapidly skin cooling system is same as cannula system, and yes, using R1438. Right. Yes. I guess it's cooling gas. is before pulling on the skin, after pulling is very quickly pulling is very safe. Next slide. Also next. This is fractional MLA beam quality. Next. Next. Yeah. Before. Next. Okay. Yeah, this is this shape is fractional tip. It's a small tip, and this is usually using window protector. Is removed, and new fractional tip is very easily insertion changing. Change very easy to. Next. Next. Okay. This fractional tip is fine leg is significant technology world first developed and very patent innovation. Yes, and then there's novel lifting, is the rejuvenation of the skin. It's using 1064. The parameter is 10 milliseconds, 82 centimeter square, and it's stimulated fibroblast and increased collagen and elastic fiber production. And this is more upper layer rejuvenation for the parameter is 600 microseconds and substitute using that. Before I'm explain mechanotransduction mediated tissue remodeling is next. I will explain you. It's very important. It's mechanotransduction. Novel toning is a fighting technique. In 755 molding is 755 use Alexandrite beam and fractional mold is a very superficial area breakdown is melanin granule. Next slide. This a long time ago, I treated some patients and biopsy and before and after and HN stain. And this is before, isn't it? After 30 days, is 1 month later, is collagen is in the marked increase. Also, Messen's 3 chrome stain also is a marked increase collagen fiber. And this 동영상 안 나와. 안 나옵니까? 안 나와요. Sorry. Your clip is not acting. Okay. Yes, after that, main presentation, after that we possible to shortcut video move. Before. What is that? This is thermal imaging camera, you know. Yes, we use fractional 1064 handpiece treatment. Yes, thermal imaging camera using at least 43 and 44 degree. We start the treatment just like that. In starting area, and then next we shortcut video shortcut. We watch that. We will watch that. Okay, next. Next, this is what is that? This is a total 6 treatment. Is once every 2 weeks for total of 3 months, and starting in March 15 to June 75. And the angle of the jaw line decrease 127 degree to 119 degree is good result. Next slide. These are some clinical data and we use parameter is 20 millimeter per cent handpiece, 10 millisecond in 80 tube, and 4 treatment every 2 weeks. Maybe a little bit. Wrinkle patient is slimmer oval face and a little bit lifting effect. Next. This is wrinkle analysis performed the Markov system. So this is wrinkle analysis system. This is all the count area. Next. This is wrinkle count data. Is all face area here. Is A as 15 to 9 degrees, and area C is 12 to 4. This E is 24 to 16. Average area is 15 to 10. This decrease wrinkle count. Next, the other patient, lateral elbow and very orbital area. Yes, next slide. Also wrinkle count. Next. Also in A area 16 to 11. Yes, and area B is 27 to 16. Just like average is 14 to 9. These two patients, both the case using parameter is same, 10 millisecond, that's 82% in the scale, and applied in 5 passes, just one treatment, 5 passes across the entire face, and 3 and 4 treatment session, but a patient reported treatment, patient feeling the very, not painless, and a little bit warming sensation, no pain. Next slide. This is before. This is our previous study on dermatologic surgery. Next. This is the study is retrospective analysis of treatment of melasma using long-pulse Alexandrite laser in Korean patients. Next. Clinical evaluation. This result is 70% is melasma improvement, 5.6% is long-term result, and 205 personal thought is using that. And treatment versatility showcase. Here, this is in already documented study patient. Is before this patient is more 20 times more QCT and that treatment for side effect or lots of hypopigmented lesion and also hypopigmented area also. We use very low QCT and that treatment and then fractional 755 and also long pulse and that or triple toning using triple toning. After that is very good result. Next, the same case also is hyperpigmentation and melasma area. Yes. This patient is also a little bit good effect and a little bit whitening. Next, also using the melasma and melasma is a little bit improvement and whitening. Next. This is lentisin and melasma and then and all of that same treatment protocol is usually QCTNDR and longosendia and personal handpiece using that. It's very good result there. Next. This is vascular telomere, facial telomere ataxia. It's a very superficial lesion. It's first side 2 millimeter, and pulse rate is 10 millisecond, and fluence 195. Usually, facial telangiectasia is pulse rate is 10 millisecond or 8 millisecond. And fluence and differentiation is 119 to 200. And 200 about just like that. Nasal area, nasal area telangiectasia also 10 millisecond, 200 to that. And leg pain, this is leg pain. Leg pain is more deeper than blue vein. Usually, leg vein parameter is more aggressive. Yeah. Usually, spot size 3 millimeter and pulse rate 225 millisecond and fluence is 250 joule. It's maybe this time just one time is clear. Sometimes 2 or 3 times. And blue vein next. Yeah. This is infraorbital or interorbital blue vein. Usually this just 1 or 2 times. This blue vein is 5 millimeter. Pulse rate is 50 millisecond. Fluence is 95. Sometimes 100 joule. Yes, just one time, and after then, 1 month later, you try one time. Yeah, use facial blue vein also. Same parameter before. Yeah. Here, parameter is also 5 millisecond, 50 millisecond is 90 to 100 joule. Usually just one time is clear. Usually. Okay. Next. This is acne redness. Is usually recently before different. Recently is acne redness also treated with this fractional long pulse and YAG laser using just 3 treatment or week interval and pulse rate is 10 millisecond and fluence is 82 and active area also all of the pace and just like maybe 5 to 8 passes just one time. All face. Next. Erythema index, very clear up. Yeah. 2 months different, just 2 months. Next. Is the acne redness. All my case. Next. Yes. Active acne and acne redness also clear. Next. Same. It's a little bit acne. Okay, next. Yes. Yeah, usually only laser and skincare. Yeah. Skincare, a little bit skincare, extraction and then after laser. Some patients, yeah.
Or in the same time?
Yeah, same time. Yeah, same time.
Without
Yes, and that more. Yeah. Maybe next. This patient is impossible only laser. This is not my case. This is Thailand doctor. Is very famous doctor, Dr. Niwat. You know, Dr. Niwat. You don't know? He's from Thailand. He's very old man. Oh yes, world first laser toning treatment. You know, Q-switch laser toning treatment. This Dr. Niwat is world first. A very famous person. He used a little bit isotretinoin also together and laser treatment. This is it, not my case. Okay. Then, this hair removal is this before and after is actually woman's forearm hair is very thin hair, but just one time after them, very appropriate reaction is perifollicular edema and also erythema. Is very good. Is presented. Usually parameters 10 millimeters per size, 3 millisecond. This is skin type 3 to 4 in Korean patient and 9 joule. Usually I use skin type 4 patient is 80 joule, 65 patient is 7 joule, just like I use that. It's my customer, hair removal, my customer is maybe 30% is Thailand people and Vietnam people also. In Korea, a lot of Thailand people live in Thailand people. It's maybe bikini line also. No problem, no any other side effect. 7 joule, 6 joule use that. But I worry about some burning. Don't worry, more lower energy use, no side effect. Why? This cooling system is gas system is very powerful. Don't worry. Next. Thin hair also. Next. And thick hair. Usually, man is very thick hair. So maybe in Middle East area and Europe, and man is don't want to hair removal, but Korean man, recently Korean man is a boomer the hair removal. This man removal is very boomer. We actually use, I recommend 10640 nanometer. Why? More deeply penetration, more powerful hair removal is 10640. Next. And why use laser rejuvenation? Why use laser? Any other EBD, any other skin booster? Why we use laser? EBD device as needle RF and Somad and Ulcera, and this purpose is lifting and skin rejuvenation. But usually EBD is high temperature, right? Yes. Actually, Somad is under the skin. How many degrees? Usually 50 more. Ulcera is how many degrees? Maybe 60 to 70 degrees. Yes, right? Short recovery, but very painful, is right. And skin booster also. Exosome, Lizuran, Juveru, Prohealer, lots of skin booster. And injection is very severe. Sometimes short recovery period. But laser is no recovery time and mild pain. Why? Under the 45 degree. And possible lifting, rejuvenation, also whitening. Yes. Next slide. Yes, that is main PT. Okay. Experimental. Skin rejuvenation. There is no clinical paper, especially 106 for Prexanet, no clinical paper. That is why we designed our experiment using investigation using SD lab, and then this is in identify most effective pulse duration, most effective power, and why just like theory, possible to lifting and possible rejuvenation. We want to know that. It's an experiment. Next slide. This is tissue and cellular change and post-aging lab model using long pulse and depressional handpiece. Next. This is SD lab. SD lab is very big size, Usually using nude mouse very small. SD lab is just like the very big size. And the skin is just like human skin, thick skin, and no fat, but no fat. And thickness is very good. So we use SD lab, and then just 34 days UV irradiation in 2 days one time, and this is control low U, and this is 2, 3, 4 condition, 3 group, and all the skin all the okay. Next. Yes. Condition 1, 2, 3 is first duration is 600 10 millisecond. Number of shot is 200, 20, 10, 10. The shot interval is 1 second, 5 seconds, 30 seconds. And irradiation temperature is the last temperature is 44 degrees. Yes. Next. This is control, no laser, and 600, 10, and 5 seconds, and 30 second interval. All cases, no tissue degeneration. Yeah, this is very important. No change, no skin change. Oh, no skin change is no effect, is right? Yes. No change is no effect. Okay, next. This is macrophage type 1 stain. This is control, 6, 10, and 30 seconds. It's all skin area, upper dermis, middle dermis, lower dermis. And macrophage type 1 is control is a lot. And this is 10 millisecond 82, and 5 second interval is decrease, a lot of decrease. Number 3 is a lot of decrease. Macrophage type 1 is function. Macrophage type 1 function is inflammatory reaction against pathogen. If your virus and bacteria, any other foreign body is macrophage type 1 very increased there. But is after laser, is macrophage type 1 is decreased a lot. This means is very important. Next. This macrophage type 2 is same condition, is very increased data. All of the mid dermis, upper dermis, and lower dermis also increased data. This macrophage type 2 is function is usually reactivation, regeneration of the skin, remodeling of the skin. Marker is macrophage type 2. Next. Also, fibroblast stain is pigmented stain. Also, this condition is a lot of increase all of the skin area. Next, stem cell. Also, this condition is a marked increase. This is 100% real data. Next, before. Yeah. Already stem cell is increased stem cell. Stem cell possibly differentiation. Usually differentiation. Number 1 differentiation. Stem cell is differentiation to fibroblast. Yeah, it's right. Fibroblast increased collagen fiber, elastic fiber also is right. Yeah. Another differentiation, stem cell differentiation, another. Is stem cell differentiation, another stem cell. Is right? Yeah. Stem cell differentiation to adipocyte. Is it right? Yes. Also possible to adipocyte. Stem cell differentiation to another, pericyte. Pericyte is vessel, very vascular cell, vascular pericyte is differentiation to pericyte. Also, yes, this is very important. And then, next. Why stem cell is activated? Who activates that? pH1 channel. pH1. pH1 is, what is pH1? You don't know that? pH1. pH1 is pH type mechanosensitive ion channel component 1. we pH1 protein analysis is also 10 millisecond, tension 5-second interval is increased pH1 protein. This means pH1. This is what is pH1? It's a transmembrane protein in cell membrane. This function is a mechanical sensor and convert the physical force into biochemical signal into the cell. By cell proliferation and migration, and differentiation, tissue repair, inflammatory immune response. I don't know why. This means I don't know why. Next. Actually, laser irradiation in the skin, and this is mechanical stress. Understand? Yes. Laser action is number one. Absorption spectrum number one is black color, red color is absorption number one. Number two is shock wave. Shock wave is usually using nanosecond. Picosecond is a lot of shock wave. Is remove the have to remove is using mechanical effect. Is using shock wave. Yes. But millisecond is impossible to shock wave, But Nobleen fractional handle is very small, 300 micrometer size. It's possible mechanical stress in the skin and mild thermal expansion is possible to activate pH1 channel and lead to calcium activation, fibroblast, and collagen synthesis. This means is mechanotransduction mediated tissue remodeling. This means that a little bit understand, but not to 100%. Let's go. Okay, we go. And then, really optimize long pulse Nd:YAG laser, that is the energy, what energy is better than any other. So we, another try, that model, okay, go. Is 5 group, 2 months utilization, then next, condition 1, 20 milliseconds is more good, I don't know, 15 and 10 and 5 milliseconds, all 5 group using energy same. Next. Just one data is very good result. 10 milliseconds, 10 seconds, 12 shot. Thermal sickness increase. Next. This same data is collagen fiber is green color. Same data is increase. Next. New synthesized collagen fiber is blue color, and mature collagen fiber is red. All data is increased 10 milliseconds, 10 seconds, 12 shot. Here, yes, mature collagen is new collagen also increased. Also, this is a little bit good, 10 milliseconds, 15 interval time, also good. Next. Elastic fiber increased, same. Next. Basement membrane thickness also good, same parameter. Next. This summary, and we are resulting finally know condition 3, 10 milliseconds, 10 seconds, and 12 shot, 10 second interval. Is very good result. Is that next? Yes. This one. Okay. This is our conclusion. Our experiment recently ended career, and maybe 2 months, 3 months later, this paper was printed. Yes, maybe next year it print out there. Okay. Next. Yes. That's good. We'll look at the video clip. evidence-based treatment type is next. Next, yes. This is my case. Melasma post-inflammatory hyperpigmentation is using triple toning method. QCGN dot or picosecond and novel fractional 1064. After that, 755 fractional and is using. This one, QCG and Nobleen 1064 fractional is same time. It's possible to same time, 2 weeks, just one time treatment. And final is Nobleen 755 fractional is 1 month, one time treatment. Is QCG NDR is very low power, 1.2, 1.4, maximum 1.8 joule per centimeter square. All of the base, maybe 2 passes, just like that. And fractional using, this is one to rejuvenation of skin is basement membrane, and using as 10 millisecond constellation in 80 joule. We experimental study is clear, is 10 millisecond constellation in 80 joule. And finally, novel technique, this is for the whitening on the skin, is melanin granule is maybe 1 week later, is gone. Maybe just one time, 20% more gone. Yes, using 1 millisecond constellation and 30 to 40 joule per centimeter square. Yes, using only for superficial pigment. Yes, okay, next. And then epidermal pigment region. The epidermal pigment region is usually freckle. Freckle is very easy to control. We use 755 Alexandrite, yes, per side, yes, 2 or 3 millimeters per side. And pulse duration is 0.2 to 1 millisecond short pulse rate. Yes, target just one time, just like using. And pre-cooling and after cooling also use gas cooling using that. And fluence as 30 joule to 50 joule. It's very safe treatment. Just one time treat, and 50 and 60% is clear. Next, solar antigen treatment protocol is usually A spot is caused by UV and treatment wavelength 755 and spot size 3 millimeter. But age spot is relatively more thick than freckle, more thicker. Yes. And pulse duration is 5 milliseconds more. Sometimes 10 milliseconds, sometimes 50 milliseconds, just like more big, longer pulse duration using influence also very, very high power, 80 to 100 joule. Yeah. And vascular also explain, yes, target is oxyhemoglobin. Yes, superficial donor vessel, and you need 1064 NDR laser. And optimal parameter 2 millimeters per side, 8 to 10 millisecond pulse duration, and 200 joule is clinical optimization parameter. Is next. And blue vein and red vein also explain. Red vein is more powerful using, yes, 3 millimeter, 25 millisecond, and 200 to 250 joule is red vein. And blue vein is same, is 5 millis diameter, and 30 and 50 millisecond is 90 to 110 joule. Okay. This hair removal is very easy to control. And actually, as Korean skin type 3 to 4 patient is using 9 joule, but skin type 4 or is 8 joule. More black color is more down, is 6 joule and 7. Yes, next. Rejuvenation, already explained that. Mechano transaction mediated tissue remodeling. And hemiphase, and totally hemiphase. 5 phase after that, the other phase, 5 phase, just right. 2 weeks, one time. Whole of the 5 on 6 session is good treatment. Next. And this is very safe treatment protocol. It's okay. Yeah? Yeah, that's good. Good. Yeah. Yeah, this is clinical outcome. Is 85 patient certification. The session time is, I think, 5 times more. The session is good. Every 2 weeks is very good. Usually 1 year duration. It's good. It's done. Its next step is we live demonstration. And volunteer and your doctor work together. And conversation and treatment. It's good. Yes. This is starting at 37.4 degrees. It's 3 degrees. It's already raging. It's raging here. Yeah. Up 40 degrees. 41. 42. Yeah. The end of study 43 degree and 44. Yeah. Good. Yeah. 43. Yeah. Thank you.
Thank you.